Hi, welcome back to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa and Hair and Scalp Wellness. And I am so excited to be here again today to talk about our third series we've been doing on behavioral health. And today is such an important topic, and I'm so excited to discuss Alzheimer's and dementia. I know that many of you at home are dealing with possibly a loved one who is suffering from both of these disorders or one of these disorders. And I have Dr. Mishra back again with me. He is the chair at Raritan Bay Hackensack Meridian, and he is also a geriatric psychiatrist. So, Doctor, I am so excited to get your expertise today and to speak about this disorder and how many people it really does affect. And I think that you giving us this information today is going to be so helpful to many of our viewers at home.
Hey, thanks, Ann. Thank you to see you again. It's glad to be back here. You're talking about Alzheimer's disease and dementia?
Yes. So maybe we could start with understanding what is the difference between the two.
Okay. So dementia is a term which denotes a clinical condition which is basically a cognitive disorder. Cognitive disorders are, first of all, let me describe term cognition if you want me.
Okay.
Cognition is the processes by which we understand through our experiences, our environment, through our experiences, our perceptions of things. And any problem with the cognition leads to difficulty understanding the surroundings, difficulty understanding the experiences we are having. So these are cognitive disorder because their basic problem is that we are not able to understand the world around us. And that is what dementia is. But dementia can be caused by, I would say, more than 100 medical conditions. And Alzheimer's disease is one condition which can cause dementia. So you can see dementia as a constellation of symptoms which can be caused by more than 100 medical entities. But Alzheimer's disease is the most common one which causes it.
So when you have Alzheimer's, you can see it in lesions, correct?
Yes.
But dementia, can it be seen as well?
Dementia, as I said, that could be because of many conditions. So just common conditions which people will be able to understand, like Alzheimer's disease can lead to dementia. Mm-hmm. Same way Parkinson's disease can lead to dementia. Sometimes even things like stroke commonly lead to dementia type symptoms. So various diseases or disease processes can lead to a constellation of symptoms, meaning a group of symptoms. And when you have those symptoms, then you are supposed to be having something called dementia. So Alzheimer's is only one, but the most important cause of dementia, so to say.
So would you say then that Alzheimer's is more severe than dementia?
No. Dementia, say like I would give an example to differentiate between these two. Say like stroke. Everybody knows stroke results in certain set of symptoms. So that is, but many things can lead to stroke. Sometimes there is a hemorrhage in the brain, bleeding in the brain. Sometimes blockage of the arteries in the brain can result in. So, but final result will be the same. So dementia can be very severe secondary to Parkinson's disease as well. So simply think of Alzheimer's disease as one cause of dementia out of more than 100 causes which
Right.
can be. But why Alzheimer's disease is so important to know about? Because it is the most common cause of dementia. Okay. So again, just to clarify once again, dementia is a set of symptoms like problems with your memory, problems with your language, problems with doing day-to-day stuff which you knew how to do before but cannot do now, problem recognizing things and people and faces. So when all these symptoms are present, then we are supposed to be, meaning we have dementia in this situation. Now, Alzheimer's disease can cause it, stroke can result in this, Parkinson's disease can result in these symptoms. So Alzheimer's disease is one, but the most common cause of producing dementia symptoms, so to say. So your doctors may say that you have dementia, you have Alzheimer's disease. Both can go hand in hand. But one person may have dementia and doctor will say that it's because of stroke. The third patient, the doctor may say that you had dementia, but it is because of, say, Parkinson's disease. Sometimes even use of medications, vitamin deficiencies, all these things can also lead to symptoms which we just described.
So medically, are they treated differently, and are there different medications for both of them?
Yes, treatment will be different. Focus has been doing a lot of research in the field of Alzheimer's disease. Just to give you an example, suppose there are 100 patients of dementia. About 60 to 70 of them will have Alzheimer's dementia. Then next most common cause is vascular dementia, meaning related to stroke and problems with the blood supply to the brain in some way or the other. So that constitutes another 20%. Then some of them will also have combined or mixed pathology where vascular dementia, meaning problems with the blood circulation of the brain, as well as Alzheimer's disease, both coexist. Then there are other forms, say remaining 10 maybe, some will be a condition called diffuse Lewy body disease, which can be the third most common one. And then so on and so forth. Parkinson's disease, Huntington's disease, all these can lead to.
So the medications would be different, and there are different.
Treatment will be different. Dementia symptoms as such, meaning you will try to treat your underlying brain pathology as best as possible. But there are certain medications specific to Alzheimer's disease. And why Alzheimer's disease? Again, because this is the most common type of dementia, meaning out of 100, 60 will have pure Alzheimer's, another 20 will have mixed with vascular. So you're looking at about 80 of 100 people having some element of Alzheimer's pathology. And that is why the treatment is focused on the symptoms related to Alzheimer's disease. So there are certain medications, there are groups of medications to help with Alzheimer's dementia, so to say.
And they're both a progressive disease, correct?
Correct.
So the medication, what does it exactly do?
Yeah, and that is what I would differentiate. There are two types of medication we can say. One, which are disease modifying. So these are some recent discoveries in field of Alzheimer's disease, and I think only in 2023, two medications got approved to treat that. And now in 2024, one will not be used any longer. So right now there's only one disease modifying agent. So by disease modifying meaning that it works on the pathology itself.
Wow.
And tries to change the course of the illness. So that is one group of medication.
Okay.
Second group of medication is symptomatic improvement in the symptoms of dementia. So memory problem is the biggest issue, so to say, in Alzheimer's disease. So there are certain medications which can reduce the rate of decline in patients with Alzheimer's disease. So that is another class of medication. And then FDA has approved certain medications for mild Alzheimer's disease, some medications for severe Alzheimer's disease. So that differentiation is there.
Okay. And as far as dementia in general, would there be any medication specific to that?
No. So specific medication, dementia again being a syndrome, can be caused by so many other. So suppose it is Parkinson's dementia. There is no specific medication developed for Parkinson's dementia, but we will focus on relieving the Parkinson's disease symptoms as best as possible.
Okay.
And there are some medications which we use in Alzheimer's disease can also be used for Parkinson's dementia, so we will use it there. Same way, if there's dementia is resulting from a stroke or blood supply problem to the brain, then we will focus on all the factors which can result in increased chances of poor circulation in the brain. So we'll try to address those things like hypertension, diabetes, cholesterol, all those things. So basically, treatment will be dependent on which condition is causing the dementia symptoms in the patient.
So, preventatively, this is a good conversation to have. I'm sure many people are wondering, is there anything that can be done?
Yes, a lot can be done, to be honest. And as I would simply say one sentence which will actually describe what we can do. Whatever is good for your heart is good for your brain. Meaning, whatever doctors tell you that we should do to maintain our heart health will also help the brain health and will help in preventing the progression of dementia type symptoms. So, for example, controlling blood pressure is very important factor. Controlling diabetes and maintaining it within normal ranges. Maintaining cholesterol levels within normal ranges. Exercise, physical activity has been shown to not prevent but reduce the progression of cognitive loss. So physical activity. Social engagement is very important factor. And last but not the least, remaining active mentally, meaning doing somewhat challenging tasks, such as brain teasers and games and whatnot, crossword puzzles. Those also have shown they will not prevent it, though we don't know that in already established Alzheimer's disease patient they can prevent. But one more thing I want to bring to everybody's attention is this, that Alzheimer's disease is generally diagnosed very late in the disease process. Just so that you know that the changes in the brain have started happening more than 20 years before
Okay.
the first symptom is noticeable. So the brain starts changing 20 years before, and then gradually progresses. Then comes a point when you start seeing the symptoms of the disease process, and then it continues progressive course, and in the end, unfortunately, leads to death. That takes another 8 to 10 years. So the focus nowadays is that what can we do in the preclinical stages to prevent Alzheimer's disease, and all these things which I talked about: social activity, mental activity, physical activity, diet, maintaining heart health by controlling blood pressure, diabetes, and whatnot, cholesterol. If it is done in preclinical stage, then there's very good likelihood that cognitive problems will be delayed even further or may not happen at all.
Sure. But then there's a part of me that says, could there be a genetic component? Is that something that they're looking at? Like, if someone generally leads a very healthy lifestyle and maybe was very active and did all these things, and all of a sudden, they get that diagnosis, I guess it could be hard. And you try to wonder, like, could this have been prevented? And could it be stress? Could it be our food? Is it happening more now than it was before?
Right. It's a very good question, because there is a definite genetic component to Alzheimer's disease in particular, and other types of dementias as well. So let's stick to Alzheimer's disease. And Alzheimer's disease is of two types. One is early onset, which is heavily genetic in nature. And this condition develops before 65 years of age. And there's strong family history in these patients, and is very rapidly progressive compared to late onset.
Okay.
So, but fortunately, early onset Alzheimer's disease is much less common than late onset Alzheimer's disease, which starts after 65 years of age. Those early onset Alzheimer's disease, only 5% of the total numbers of Alzheimer's disease patients. But as I said, that is heavily genetic. And of course, you would like to do everything right, but it may not be preventable because it is genetically destined to happen. So that is one. Second type is what we call sporadic or late onset Alzheimer's disease. That also has strong genetic component, but not as much or not as sure as it is in early onset. So for late onset or sporadic Alzheimer's disease, what we can say that certain genetic structure predisposes you to have, meaning it increases the likelihood of you getting the Alzheimer's disease compared to somebody who does not have that genetic structure, right? So in those cases, of course, if we take all these preventive measures, we may be able to delay the onset even further. But because genes play a bigger role, it is likely that you may still get that. So my answer to questions on genetics and Alzheimer's disease will be that an uncommon variety of Alzheimer's disease, about 5% of the cases, are truly genetic in nature, and really they start very early, progress faster, and there's not much you can do, although healthy lifestyle and everything should still be observed, and whatever treatment is available we should still try. But on late onset Alzheimer's disease, which constitute most of the Alzheimer's disease patient, genes only predispose you to have this. They don't cause the illness, so to say.
Right.
And taking all these measures, treatments will have much larger impact in this population.
Okay. I mean, that makes it extremely clear.
Yeah.
You're so good at expressing all of this because it really is helpful into understanding. And so as far as like, let's say, someone like myself in my 50s, is there any supplementation that you think could be helpful? I mean, you see all this brain vitamins and things. I mean, is that something that you think has any kind of a validity?
I will say this, I will stick to what FDA recommendations are. So there's nothing which has been approved as far as to take this supplement which will prevent Alzheimer's disease or developmental dementia. But as I said, that there is a lot of evidence that maintaining weight, dietary measures which will keep cholesterol under control, like Mediterranean diet and all that. There's something called diet to prevent hypertension. Those diets have been proven helpful. So there's no supplement. I know there's so many you see on TV which has been FDA approved that this will improve your cognitive function or brain function as such. But those factors which we discussed, staying healthy, staying active, staying mentally active, socially connected, maintaining weight, and observing healthy diet patterns which are considered good for your blood pressure and for your heart will definitely help in preventing the onset of these symptoms or delaying it considerably.
And so clients that are suffering from it, do you think that diet is valid at that point, or do you think it's not as important once the disease has already started to progress?
It is still important for two reasons. Number one, as I said, that many patients will have a mixed type of dementia, where the component of circulation problem and Alzheimer's disease, both of them are there. So in vascular dementia, meaning circulatory problem which result in dementia, it happens because vascular disease progresses. So anything which we can do to slow down the progression of vascular disease, meaning circulation problem, is likely to help the brain, because brain will remain functional. So first of all, you would not know many times whether we are dealing with mixed dementia here. So thinking that yes, there may be a vascular component and managing that will automatically help. So in those cases, you will be helped by still maintaining the diet which is healthy for your heart, so to say.
Sure.
Secondly, in people who are, suppose they are pure Alzheimer's disease patients also, and you maintain all the dietary measures and all these preventive factors which talked about, there's still some evidence that even the progression of cognitive decline can be slowed down to some extent.
Okay.
So yes, I would say that still it may not be able to totally prevent from progression, but definitely will help in management of Alzheimer's disease and dementia symptoms better.
So I wanted to discuss long-term and short-term memory a little bit, because I know in my dealings with some of my friends who have dementia or Alzheimer's, sometimes they can recall things from very long ago, but then they just forgot, something that you may have done just in the last few minutes.
Correct.
So how do you think that is a factor. Why do you think the brain is working that way?
Yeah. So for that, we will have to understand how the memories are stored, in the brain. And what happens is that you first of all, you have very, very short-term memory, which is registration that when I'm talking, you're registering my words. Then they go into a short-term reserve, and then they're transferred into long-term reserve of the memory. This long-term reserve of the memory is more resistant to decay, so to say, compared to short-term memory. So what is happening in the brain of an Alzheimer's disease patient is that, as I said, 20, 22 years before we even notice first symptom of Alzheimer's disease, there is some abnormal accumulation of certain proteins, which are normal, so to say, normally present in the brain, but an abnormal form starts accumulating, and that's called amyloid protein, so to say. So that is getting deposited, which is considered to be toxic to the nerve cells. Then there's another type of protein which starts getting accumulated inside the nerve cells called tau protein. So all these are neurotoxic substances. What they do, they not only they're toxic, but they also, tau protein is actually provides the skeleton to the nerve cell. So when abnormal tau protein is accumulating, that skeleton gets lost, and that's why the cell collapses. So that is how these protein collections or accumulations lead to death of the cells.
Okay.
And in Alzheimer's disease, it is so interesting to note that this process happens first of all in the areas where we form memories, called entorhinal cortex and hippocampus. So just think of that hippocampus is responsible for managing these memories in our brain, and if nerve cells in the hippocampus are dying, the reserve gets smaller and smaller and smaller, and that is why initially you will see that person is able to recall his childhood wonderfully, but if you ask what you had in breakfast, probably he has no clue that he even had breakfast. So
Right.
that is how short-term memory is affected first, but with due course of time, almost whole brain gets affected, and that's why almost all functions are lost, including long-term memory. Just already know that the effect of Alzheimer's disease on brain is so severe, progressive but severe. Say not suppose, it is common knowledge, little difference between male and female sexes, but brain weighs about, say, 3 pounds or so, normal brain. And with Alzheimer's disease, when it is fully settled in, you can see up to 20% reduction in the brain mass.
Okay.
So this many cells have lost, billions and billions of cells have been lost, and that's why, as I said, initially because it is memory area which are affected, but gradually whole brain gets affected, all functions are lost.
That's so important to hear you say, because this really, as much as we think we're dealing with someone's mental mind, we're also dealing with their physical body.
Physical body as well.
So I'd like to use a little bit of the last of our time to talk about the caregivers and the people who are loving the people with these disorders and how they can get through it, because it can be very hurtful, for the ones around them.
Right. Absolutely.
Any good advice for dealing with that?
Yeah, and just one thing which is very important for caregivers to know and everybody to know, that caregiving burden is a very common cause of anxiety and clinically significant anxiety and depression in caregivers. So many studies have shown that about 30 to 40% of people who are providing care to the loved one related to mainly dementia, but any other, when the person is dependent, leads to anxiety and depression, which needs to be treated. So first of all, the person has to take care of, caregiver has to take care of himself or herself. The reason is another one I will tell you, that we clearly know that institutionalization, meaning when the patient has to go to nursing home, not only results in poor quality of life, because there are a lot more medical problems they experience once they are institutionalized, but it's also proven without doubt that their lifespan is shortened. compared to people who stay at home, compared to people who go to nursing home. People staying at home have generally longer lifespans. So institutionalization leads to not only poor quality of life, but shortened life for the person who is going to the institution. Now, second fact which we all should remember, that person staying at home is directly proportional to the health of the caregiver. So if caregiver becomes unhealthy for whatever reason, the person will be institutionalized and will have its own consequences. And that's why I would say that it's very well known fact that caregivers do get anxious, depressed, develop multiple medical issues of their own, and taking care of your own health is equally important. So there are various ways which we can do it. Securing help from your loved ones, who can help in the situation is one way. The respite care is available in many communities, so you should look for. If we run out of time, I don't want to run out of time without mentioning something. There's a resource. I would say that anybody and everybody who is interested in should go to Alzheimer's Association webpage. You would find so much information about all sorts of dementias, but mainly about Alzheimer's disease. And they have all the resources listed there for caregivers as well as the patients.
Well, we will definitely put that on the bottom of the screen today so that people can see that, because you do need support, and you need community, and you need self-care. So all of these things are very, very important. And I would say that mentally, even speaking to someone about what you're going through as a caregiver, seeking some therapy for yourself so that you understand, the process of walking through this, because it can be a sort of mourning. It's mourning the loss of your family while your family is still present.
Still present.
And I think that's a very valid point, that, people are mourning while they're going through that. So.
Going through. Because the person who is there is only a skeleton of the person who used to be there. So they are mourning while taking care of the person still. And as I said, more than 1/3 will have clinically significant anxiety and depression. So definitely they should have help of their own. And who knows that if there's need, then it may need to be treated with medications,
Yes.
depression and anxiety. So yes, definitely.
Well, this has been a great, great topic. I hope that we are helping so many people, Doctor, and I know that we are. And I think that the most important thing that we've learned in this 3-part series is that mental health is just as important as physical health. So you being here and helping us shine light on all of these things has been just extremely, extremely valid and important to all of us. So I appreciate that so much.
And thank you, Ann, because you bringing these topics for discussion with your audience, I appreciate it very much, because mental health is not something which is discussed commonly. So I'm really grateful that you're doing it for your community.
Thank you. Thank you. Thanks for being here.
Thank you.
And we'll see you again soon, I hope.
Oh, definitely. Anytime.
Okay. Thank you.
Thanks, Ann.
And thanks for joining us today on Wellness Woodbridge. We're so glad that we were able to come into your home, and hopefully we're speaking to you about things that are concerns and that may be weighing on your mind. And I hope that we gave you some very, very important information today. So we appreciate being with you and being part of this community right here in Woodbridge and all of its surrounding areas, that we have so many wonderful doctors and mental health professionals that can be there for you while you're dealing with many, many issues: anxiety, depression, Alzheimer's, dementia, and all of the above. So thank you again, and we look forward to seeing you again soon on Wellness Woodbridge. Have a great day.